Hello, I'm Debbie Litton, the Supervisor of Student Services, and I'm here with Becky Cooper, the Nurse Coordinator for the School Division. In an earlier video, we provided an overview of the strategies that we are using to prepare for students to return to our schools. We are using strategies to help prevent the spread of COVID in our facilities, and we're trying to keep our facilities safe and healthy for the students and staff. We'd like to take a few moments to give you some additional information regarding the medical services that are going to be available throughout the year. All of our clinics are staffed with a school nurse who is available to answer any questions that you have, and I highly encourage that you reach out to your school nurse if you have any questions. Now I'd like to turn it over to Becky Cooper to talk to you more about what our clinics look like. Ms.
Thank
Cooper?
you. Providing good health services for students is always a goal for our school nurses. This year, it is critical for the nurses to be vigilant in protecting the health of our students using our best practice health standards. As a result, some of our services are going to look a little different. First, I want to talk with you about the clinics. The clinics are set up differently from last year. Spaces have been designated for well visits and sick visits. In order to protect our students' health, the clinic will be limited primarily to students who are ill. You will see at the clinic door an area marked off for all visitors. Students will be met at the door by the school nurse to assess the medical need. They will be directed to the area of the clinic which addresses that need. We want to make sure that those students who are ill are cared for in a different area with proper barriers. There are some situations in which non-ill students will come to the clinic. For example, students who have medication to take or students with more significant injuries. There will also be a change this year with the number of students allowed in the clinic. Although some students will be coming to the clinic for certain services, for the most part, we are encouraging students to remain in the classroom unless they are ill. The nurse and the teacher will maintain close communication about any student who may need a referral to the clinic. For minor situations, the classroom teacher may tend to the needs of the student in the classroom. Teachers have been provided with a variety of first aid supplies to provide minor first aid services. Again, our intent is to provide the best health protection we can for our students. And last, I want to talk with you about medications. If your child needs to take medication at school, please submit your physician's orders to the school nurse along with the medication that will be kept in the clinic. Your child will come to the clinic to take medication. The nurse will meet him or her at the entrance to administer that medication just inside the doorway in order to provide the best health protection we can. And we hope this will be a good plan for you and a good plan for us. It is certainly different than what we've been used to doing. We thank you for your understanding and your support. We are all in this together.
So if you have any questions, please contact your school nurse to identify how we can help serve you and your child's medical needs while at school. A healthy child is a child that's ready to learn, and it is the goal of our nursing staff to help your child reach their academic potential by staying in school and staying healthy. Continue to follow the CDC guidelines and the Shenandoah County Public Schools Smart 4 logo. Make sure you wash your hands often, wear your mask, social distance, and stay home when you're sick. Let's all be safe and stay healthy.